Fox is where the news is. Fair and balanced.
President Obama is using his ability to make a recess appointment to put Dr. Donald Berwick in charge of the Centers for Medicare and Medicaid Services without confirmation from the Senate. Berwick is a pediatrician, Harvard professor. He leads a health care nonprofit group which has the support of the American Medical Association. But many Republicans say they want a chance to publicly question him about some of his statements, like a speech to the National Health Service, the NHS, where he said any health care plan that is just, equitable, civilized, and humane must redistribute wealth from the richer among us to the poorer and less fortunate. Excellent health care is, by definition, redistribution. Let's get into the debate here with David Winston, a Republican pollster and a former advisor to the House Republican Conference. Bernard Whitman is a former pollster for President Clinton. To you first, Bernard, do you say this is an excellent appointment? You like this guy, but shouldn't he receive the approval of the Senate before he gets put into an important job like this?
The fact of the matter is Dr. Berwick is an expert on patient care who has spent a lifetime challenging doctors and hospitals to provide health care of the highest quality that's safe, effective, fair, and equitable. And the truth is, the false charges and vicious attacks that the Republican Party has thrown up against Dr. Berwick are symptomatic of the Republicans playing politics with people's lives. And the American people are sick and tired of the Republicans' jaded strategy of just say no to governing. If the appointment could have gotten a fair hearing, then yes, absolutely, he should have. But the truth is, this Center for Medicare and Medicaid Services desperately needs a full-time leader, and I think Obama's appointment is exactly right and appropriate.
All right, well, David, if he is the right guy for the job, wouldn't he have won Senate approval?
Oh, sure. And the fact is his nomination was just put up at the end of April. So it's not like this has been any particular long process. And I have to go back to it. Look, this isn't what Republicans are saying. This is what this guy said himself. I mean, he is a fundamental believer in rationing. He said so. And what does rationing mean? Those people who have health care give it to those people who don't. And the American people don't like that direction. And that's why they didn't like this health care. In the most recent Real Clear Politics average, 42% favor this health care plan, 51% oppose. And what the administration is simply doing is ducking this argument. They're scared of what this would bring.
One Republican senator, John Barrasso of Wyoming, who is a physician himself, had this to say yesterday. He said, this recess appointment is an insult to the American people. Dr. Berwick is a self-professed supporter of rationing health care, and he won't even have to explain his views to the American people in a congressional hearing. Once again, President Obama has made a mockery of his pledge to be accountable and transparent. What about that, Bernard? I mean, shouldn't he defend these views if those are the views that he holds?
I think the insult to the American people is the Republicans' attempts to somehow pretend that this bill is not the law of the land. And no amount of trying to roadblock or forestall the implementation of the health care bill is going to prevent it from becoming law. I think what's really at play here.
You're still not answering the question. Answer his question.
Look, if he could have gotten a fair hearing, absolutely, but it was very clear that the Republicans had
So you're saying the White House should duck any hearing because you think they might not get a fair hearing? That's absurd.
The Republicans were clearly going to play this out through the November elections, and they are absolutely terrified that their strategy of running against the health care bill is turning into an enormous flop. And in fact,
what this is we oppose rationing, and you apparently support rationing.
No,
I mean, that's a clear debate that should be put in front. That's what he's for.
Strong majorities of the American people, including Democrats, Republicans, and independents, support all the key elements of the bill, including closing the donut hole, subsidies for Americans to buy insurance, the exchanges, and
give me a survey where that backs that statement up.
And Bernard, you know, he has lauded Britain's health care system, you know, a very social kind of socialist system that involves a lot of rationing.
This guy has a demonstrated record of success in helping push hospitals and doctors to deliver fair, equitable care to millions of people. And that's exactly what we need to get this health care law enacted. And in fact, the Kaiser Permanente survey that just came out showed strong majorities of even Republicans supporting all the key elements of this legislation.
All right.
And overall, 48% of the American people are favorable, contrary to the poll that you cited.
David, let me read you a quote from White House Communications Director Dan Pfeiffer. He said, many Republicans in Congress have made it clear in recent weeks that they were going to stall the nomination as long as they could, solely to score political points. I guess if the president has the power to make a recess appointment, isn't he allowed to do so?
Oh, he certainly has the power, but I mean, I think everybody should understand this guy is for rationing. This White House doesn't want to have this debate right now, given the negative attitude this country has toward this health bill. So this is just an excuse to duck the debate. That's all it is. It's simply an excuse. They know the damage that this guy will cause in terms of the public's reaction to him.
Bernard, what happened to the president's promises of transparency?
And in fact, if you look at the number of recess appointments that were conducted by President Bush up to this point in his administration and President Obama, the number is 15 for both up to this point. The recess appointments are regularly used. This is not that surprising given the fact that the Republicans are doing everything they can, including frivolous lawsuits, to somehow prevent this bill from actually taking effect. Well, it's the law. Deal with it.
There are a lot of people who don't like the law, though, right?
That doesn't mean you can pretend it's not taking effect.
But I thought this president was going to change that.
And in fact, he completely changed health care in this country, and we have got to get the Center for Medicaid and Medicare Services ready to start implementing this law. That's exactly what this president promised to do, is bring about change.
And cutting out that $500 billion from the Medicare budget, I guess. Bernard Whitman, David Winston.
Through rationing, apparently.
Thank you both.
Thank you.